Hello, my name is Wes Jacobs. I am the founder of Apollo Medical Travel, and I'm coming up on 200 full mouth restorations here in Latin America. I've been doing this since 2020. And today I want to talk to you a little bit about the prosthetic itself. One of our most common questions we get from people is can I get my crowns or can I get my prosthetics in a way that doesn't have any of that fake gum? And so people are essentially asking is, can I avoid this kind of prosthetic and get a prosthetic like this? And, I want to talk a little bit about the fundamental problem that we're addressing here and why or why not you might be able to get a prosthetic without gum. So when you're missing your natural teeth for any period of time, the bone will go through a process called resorption. And resorption is where, in the absence of the stimulating effect of the root of the tooth, the bone will start to deteriorate and go away. If you've ever seen somebody who's older, who's been missing their teeth for many years, they get this shrunken appearance in their jaw, and that is the long-term effect of resorption. And so you can imagine this is like a laboratory impression of some of these gums, right? And what we're trying to do is get a flush surface between the prosthetic and the gum line and distribute the pressure in a way that makes sense for the tissues of your mouth. And so when the lab team is designing a smile based on a digital impression or maybe a physical impression, depending on where you go, the only reason that they would put in gum is to accommodate for some of that uneven surface as a result of resorption, and to just make sure that you've got a proper bite and a prosthetic that doesn't put pressure on any one part of your mouth. If you're immediately getting your teeth removed, it's going to be likely that you can have a prosthetic with a limited amount or no gum line, something like this. Kind of looks goofy, but you got me. And that's essentially the problem that we're trying to solve. We're not trying to force a gum line on you, but like as you can see, the fundamental problem here is we're accommodating for missing tissue, and we're trying to give a uniform appearance to the teeth. And your alternative to having this gum is to have extra long, like unnaturally long teeth. It's something we can do, but that's an aesthetic choice that you have to make as the patient.